All right, hello, my name is Robyn Burgess, and I'm completing my BA in Health and Community Services. Today I'm going to be sharing how I was able to integrate the public health and social policy knowledge, skills, and values learned from this program into my practicum experience at Foundry in Kelowna. Foundry is an integrated health and social service center initiative for youth aged 12 to 24 in BC. And there are currently 7 centers in operation with 4 more planned to open in the coming year. There we go. Foundry's vision is to transform how youth and young adults access health and social services within BC. Their guiding principles are to provide comprehensive system of care where health promotion, prevention, and early intervention are core components, to ensure services and the timely and accessible so that youth and their families can access services when they need them, to provide youth and family-centered services in order to empower people to take control of their own health, and to integrate services through collaborative relationships and the building of meaningful partnerships within the community. Some of the programs and services offered at Foundry Kelowna are mental health services, primary care, substance use programs, youth and family navigation, and social services. My role at Foundry Kelowna was to support the planning and consultation phase for a new project, currently being referred to as Foundry Mobile. Foundry Mobile is going to be the first mobile health unit for youth in BC, and it will service ages 12 to 24 years as well. The tasks that I completed during my practicum where I organized and summarized data to identify which schools in the Kelowna area were dealing with barriers to access, and then organized that data into a community engagement report. I worked with a fellow student from Okanagan College and helped to facilitate focus groups with youth in the community and learn about current barriers that they felt that they had to access and which services they thought would be beneficial for them to have on this unit. And I also began an environmental scan to gain insight into mobile health units, the different specifications in order to give us an idea of what that vehicle might look like in the future. During my practicum, I utilized inquiry and analysis to summarize data that was sorted into categories like age, school attended, and education level. This allowed me to use statistics like frequency, percentage, and mean to explore their characteristics. Throughout this process, I critically appraised health information and used my written and oral communication skills in all roles. The report I created is visually appealing, easy to interpret, uses appropriate branding and language, and is easily transferred into multiple formats. By practicing good oral communication skills when meeting with professionals and youth, I was able to connect with people clearly and carry rapport. And in order to engage in culturally safe practice and develop my own cultural competence, I focused on reflecting on my own culture, participating in open and respectful communication, and recognizing and avoiding stereotypical barriers. The following 3 values guided my practicum placement. By supporting community engagement initiatives and working with local organizations, a community-based approach is being used to inform this Foundry Mobile project. When organizing youth focus groups, we had to think about how to engage diverse populations of youth in order to get feedback from those who are less engaged, those that are living in locations where access is potentially a barrier, and youth that are part of the West Bank First Nation, which is just across the bridge. This project will require the application of a deep understanding of determinants of health and health inequities throughout the entirety of the project from beginning to end. The goal is to improve the health and reduce health inequities of youth in our community, and hopefully in the future this will be something that can be scalable across the province of British Columbia. To achieve this, it is necessary that we continue to work with multidisciplinary teams, using a strengths-based approach and carry a focus of intentional collaboration to provide quality services in health and community care. In review, during my practicum, I was able to apply the knowledge and skills that I acquired through the BA program. Some valuable takeaways for me were the exposure to professionals in different career paths that I didn't know existed, being empowered and recognizing the skills that I already possessed that would be useful for me in my career, and using the skills that I've learned in this program in a hands-on environment, and the confidence in knowing that through this program, I've been given the tools to be successful in my career. And that's it for me.
Time for one question. I'm doing my scan. Are you stretching or do you have your hand up? Hand up. Thank you.
That wasn't obvious enough. Hi, thanks for your presentation. I'm just curious, you mentioned at one point, I'm not sure if you actually did this or if it was something that you're planning to do, but identifying schools with barriers to access. Mm-hmm. So what does that look like? What are the factors that you're looking at to identify those schools?
Yeah, so at Foundry, the actual clinic that's operating now, we looked at the data from youth that are currently accessing that site to see where they weren't coming from in this case. So for example, there were a lot of youth that we were not seeing from Lake Country and far, like across West Bank. So we had to ask ourselves, like, what are the reasons for that? And now we're in the stages of making connection with schools in those areas to figure out if the access is needed, which we've heard that it is, and what those barriers are.
I see.
Yeah.
Thank you.
Yeah.
All right. Thank you so much.
Yeah.
Yay. A big hand for all of the before lunch presenters. I think you all deserve a big hand. Yay.